Today is a condition that many of you will not have heard of or even known that it was possible. It's Kleinfelter syndrome. So this is probably more for curiosity. I've only ever come across this once, and it wasn't whenever I was practicing as a medical herbalist. Kleinfelter syndrome, KS, is a genetic condition that occurs in men whenever they are born with an extra X chromosome. Yes, you heard that right. It's an XXY chromosome, and it's a condition that affects the physical, developmental, and reproductive health. You can understand it will also have an impact on the emotional health. It's a lifelong condition, but diagnosis and treatment can help manage some of the symptoms and improve quality of life. Now, it is a random genetic error, results in a male having the extra X chromosome. It's not inherited, and it does seem to occur spontaneously. Usually people will end up taller than average with long legs and a shorter torso. They have a reduced muscle mass and body hair. They have enlarged breast tissue, so this is gynecomastia. Small testes or small testicles, it's called testicular atrophy, and a penis. Now the penis again can be quite small, and then broad hips are often in place. Now, reproductive health, you can suffer low testosterone levels, you could suffer infertility or it be difficult to conceive, and there can be delayed or incomplete puberty. There are learning difficulties associated with this condition, particularly with language and reading, and there's challenges to attention, memory, and to problem solving. And of course, there's some self-esteem and social anxiety issues with it. And when it comes to testing, generally speaking, this is done genetically, and it's a blood test to ensure that you get the right diagnosis of the extra X chromosome. There's hormonal testing to monitor testosterone, and there will be a physical examination to understand developmental milestones. When it comes to treatment, often you will be given some form of hormone replacement therapy to boost testosterone, to help deepen the voice and produce more facial hair. There will be fertility treatment offered for those that it will help in the form of IVF, and there'll be some educational support because often there are learning challenges. Counselling and psychotherapy may be necessary to help with social skills, self-esteem, and mental health. And there are surgical interventions to help reduce the size of the breasts on men and address any other physical concerns. Now, when it comes to nutrition, there are some things that we can do and there's some things we can't. Obviously, we can't change the genetic makeup, but we can include foods rich in zinc to help support natural testosterone in the system and boost the immune system. You want to ensure that you have an adequate amount of vitamin D from fatty fish for bone health because there's a risk of osteoporosis. And antioxidant-rich food like berries, leafy greens can help reduce oxidative stress. Now, when it comes to exercise, weight-bearing exercises help enhance bone density and reduce the risk of osteoporosis. Stress management, like mindfulness, is really helpful to help improve mental health. And along with some of the other herbs that are mentioned elsewhere on the courses, there are some herbs that are helpful to raise natural testosterone. So ashwagandha supports testosterone production and helps to reduce stress. Mucuna pruriens helps to enhance dopamine levels and improve mood and cognitive function. Panax ginseng helps boost energy levels and supports hormonal balance. Now, when it comes to navigating the way forward, clearly it's about trying to get the right strategy at the right time in your life to do what we want. So it's supporting testosterone in puberty, supporting fertility when it comes to wishing to conceive, and trying to enhance the strengths of a good diet and natural approach. When would you want to see us? Well, generally speaking, at those stages of life, and also to reduce the risk of osteoporosis in the future and any frequent fractures or bone pain that you might have as you age. Some of the other modules in this will be useful for somebody that has this condition, but it might be better to have individual care. For the rest of you who are looking at it wondering what on earth this condition was, Kleinfelter syndrome is clearly a difficult syndrome for those who suffer it, and you can empathize with them just as we do with our own issues on a day-to-day basis. Cheers.